disorders are the leading cause of disability-adjusted life years and second leading cause of death. Much more needs to be done to tackle this burden, especially because 70% of this burden is in low and middle income countries and where you have insufficient resources.
There are over 400 neurological disorders. Unfortunately, we know from studies that they are responsible for the lion's share of global premature deaths. They are also contributing to a massive decrease in our life's quality and enjoyment.
The burden of neurological diseases is higher than we expected and what the general population think. The frequency is that every third, fourth citizen in a lifetime will develop a neurological disease.
We came to the conclusion that managing brain conditions at the European scale every year was costing European society nearly 800 billion euros every single year. So it means bailing out the Greek debt 7 times every year.
There are hundreds of neurological disorders, some well known. Think of Parkinson's disease, stroke. But even for these, it is not commonly known that they are neurological conditions. The OneNeurology campaign is about demonstrating what makes all neurological conditions one and what it will mean if they are addressed together.
The numbers are appalling, and there are so many patterns, common symptoms, but also common issues to be tackled. And so to me, it seems a very beautiful project to target first global stakeholders, to put neurology higher up on the agenda and create a framework that those living with the conditions really, well, can benefit from in the very end.
The brain is very much connected. The different areas of the brain are connected. Sometimes the connection between one disease and the other, between one treatment and the other, is unsuspected. We are discovering all the time, new connections that link one area of neurology with another one.
The American Brain Foundation's philosophy is cure one, cure many. That's why I think patient centricity and this OneNeurology initiative makes such perfect sense, because we are dealing with one brain and we are dealing with a limited number of pathologies.
The key is to get neurological diseases really recognized as a huge burden on society. You almost get the feeling that the system doesn't really want to look at neurological diseases, because they know when they do, they're going to open up Pandora's box. They will realize the huge burden. But if they do and they start to collaborate, then we can reduce the cost to society.
I think we need to have our voices heard much better. We need to instill public opinion about the burden of neurological disease.
Parity is a gateway to transformation globally, on a global scale. We should be seeing results in less than 5 years, which would have taken us maybe 100 years to get.
We are uniting to make neurology a public health priority. We are ready to work with the World Health Organization and its member states and all relevant stakeholders to build and implement an ambitious global action plan to tackle the burden of neurological disorders worldwide. The 10 years intersectoral global action plan on epilepsy and other neurological disorders is a unique opportunity for us to build an integrated response to neurological disorder across the life course and within our healthcare systems. Over the coming years, we want to see a real change for people living with neurological disorders. At the end of this time frame, when we ask people with neurological disorder if their quality of life has improved, We want them to say, yes, we see an improvement in the management of our diseases. We have better access to diagnosis, treatment, and care. There are promising new therapies, and our needs are better understood and truly considered. And for this to happen, we need our policy and decision makers on board to ensure that the Global Action Plan is fully supported and ultimately implemented.